I'm Dr. Sridhar. I'm a consultant neonatologist and currently I work at Alain Mediclinic. First of all, calm down. There is nothing to panic. You have professionals to support you right from the time you get pregnant. Your obstetrician, the nurses in the antenatal clinic will answer your questions. Learn more about breastfeeding when you're pregnant itself, because that's the best time to know more. There is a concept called antenatal expression. There is a video on my channel on that. So you can start discussing it with your obstetrician when you reach 36 weeks. So that is one of the ways to establish the breastfeeding faster, so that in case your baby needs support after birth, we don't need to use formula. So the key aspect I would discuss today, the first topic is breastfeeding support. You might wonder why I'm talking about breastfeeding first. So it's a most natural progression. Once you deliver the baby, you want to cuddle the baby, you want to bond with the baby, and you want to breastfeed. So nature has designed us in a way that the mother has to start breastfeeding, has to bond with the baby, her hormones kick in. There is a balance of different hormones which regulate the milk output, and this balance happens at the transitional stage. When you're in labor, this process starts, and after the first day or so, as the baby starts suckling, you start producing. The breast is already ready to produce milk, but the milk isn't starting to come. Those who have had babies before, you might find a different experience. You might start secreting milk towards the end of pregnancy because the breast is already primed. There are stages of milk output, lactogenesis, so to speak. So the breast is prepared already. That is the stage of lactogenesis 1. And the milk output that I described is lactogenesis 2, and successful lactation is lactogenesis 3. So during this lactogenesis 2 is when the mother and the baby learn to feed the baby and the milk starts coming. All of you are aware of the concept of liquid gold. The first 2 to 3 days there is a milk called colostrum, and this is crucial for the baby to get, because this is very rich in protective factors for the baby. So it's very important that we don't miss out on the opportunity, and we suggest skin to skin care from the moment the baby delivers, and you start suckling the baby as soon as you are able. Do it every 2 to 3 hours in the first few days, and this is going to naturally set the process. One important point here is that the parent should be aware the first 2 to 3 days is when this milk establishing process happens. Colostrum comes in a few drops on the first day, and it goes up to 3 to 5 ml per feed on the second day, and maybe 10-15 ml by 3 days. If the mother is on medication, she's hypertensive herself, or post-cesarean section, this process may be a bit slower, but you need to start supporting. If the baby is high risk, for example, you had diabetes during the pregnancy, or if the baby has issues related to growth, premature baby, small baby, and so on, we start requesting you to express milk. One of the key things that needs to happen is for the milk that is starting to be produced to come out of the breast. So that needs milk transfer from the breast to the baby, and unless this happens successfully, the baby may not be able to successfully breastfeed. So if the baby is not sucking or not too keen to suck, or is not latching appropriately, you need to express milk. The latch, which I mentioned, is a key component of how successful the breastfeeding will be, and this is nothing but the way the baby attaches himself or herself to the breast in a way that the milk is successfully going to come out without hurting the mother as well. So your lactation consultant or your nurse might be able to guide you on this, but read a bit about that so you're mentally prepared. As I said before, if you have breastfed successfully before, this comes naturally to you as a mother, but for the baby, it's still at a learning point, and you need to adjust to each baby differently. Don't be anxious about the amount of milk you produce. The baby is absolutely fine with the small quantities we produce, and that's one of the key reasons why either parents or their relatives, like the grandparents, want to start giving some formula till the mother's milk comes. So this is a crucial mistake, because if you start giving formula, it's going to beat the natural process. The mother's breastfeeding doesn't progress as well as it should. So it's a natural thing that you're disrupting a process that should happen in a certain sequence. The baby also gets confused with the volume of milk reaching the stomach. So I'll come up to that point of vomiting next, but a baby's stomach is very small to start with. The first day it's the size of a pea, and then it goes up slowly. So just 3 to 5 ml milk can be held in the newborn stomach in the first day, and then it rapidly expands if you start giving more. So there is a reason why the stomach is small on the first day, because the baby doesn't need to get the milk. the mother's milk is going to come slowly, and when the milk starts coming, the stomach starts distending and the baby can accept more without vomiting. Suppose we give formula on the first day, like 15 or 20 ml, the baby's stomach distends suddenly, they start vomiting. They're already prone to vomiting due to the stress of labor, which I'll explain next as well. So the commonest mistake is to give formula when you can actually manage with breastfeeding, where there is a risk factor like you have diabetes, you have twins, or you have a risk of preterm labor. After 36 weeks, you can start expressing, and this stimulation and getting the colostrum out makes the breastfeeding successful. So even if the baby has a risk factor, we may have some milk in store, your own milk can be given to the baby. So resist giving formula unless it's essential for medical reasons. One of the reasons can be that the baby sugar is monitored for any reason and it comes on the lower side. But even there, it doesn't mean you need to continue the formula. You just need to give the formula for 2 or 3 feeds till you start producing enough, and you need to work on getting the latch right and possibly start expressing as well. And in case you have started formula for any reason, try to stop it at the earliest possible, because the longer the baby stays on it, the more they get used to it, and the more it's going to disrupt your own milk output. So this is the critical point about starting with